Parents, welcome you all onto this virtual platform. It's me, Abhilash Vijay Mohan Nair from B-GHUD Academy. So actually, I would like to apologize you for those technical error that has happened during the first loading session of our class. Apologize unreservedly, all my dear students. Thank you for your cooperation. Okay, so joining with me, it's Bivin and Jerin. So thank you, my dear colleagues, for making this session possible. So I hope all are watching me and do support our live session by commenting, pinning your suggestions in the comment box. Okay, so this is a way by which we could uplift our performance, that we could improve the quality of our performance. Hope all are doing good and fine. So my prayers, my wishes for all OET aspirants by next year this time. May God Almighty bless you all to be there in your dream destinations. Are the best wishes. Okay, so now, not wasting time, we'll be moving to the role play. So this is yet another examination question. Setting is a hospital ward. The question will be right displayed there on the screen. Okay, so in case of any queries, concerns or doubts, please don't forget to put on this comment box. Okay, you could pin your suggestions onto this comment box. Fine. Yes. Okay, so sitting as a hospital ward. You see a 32-year-old patient who was admitted overnight for monitoring following arrival with chest pain dizziness yesterday. All tests have proved negative, but is still being monitored by ECG. You have come to do clinical observations. Find out if patient had a comfortable night. So there are certain things that you need to notice in a question. So this patient admitted yesterday night with chest pain dizziness. Overnight monitoring. Overnight monitoring means night monitoring is over. So the time indication it is given in a hidden format. Overnight monitoring. Now it's morning time. Okay, all the tests have proved normal. ECG recording is still continuing. All the tests are negative. That means it is normal. You have come to do clinical observation. Our duty is to do clinical checks. Okay, find out if the patient had a comfortable night. This is a known case. Both patient and nurse are known to each other. We need to start by inquiring their general well-being, that to their sleep pattern. Okay, reasons for patient being woken up early. So the patient would be quite annoyed for being woken up early in the morning, but we need to tell that it's a hospital procedure, clinical observation before ward rounds is a must, blood pressure, temperature, oxygen levels, everything has to be assessed. So we need to tell that this is a hospital routine, hospital procedure policy. Find out if patient symptoms are still present. So yesterday's symptoms, the patient came with some symptoms like dizziness, chest pain. We need to ask whether those symptoms are still present. Fine. Reassure patient about heart rate. Regarding their heart rate, it is normal. Current ECG reading normal. Monitoring will be continued. No evidence of any clinical problems. We can reassure them by stating that all these findings are positive for the patient. Okay. Find out if the patient taking medication for anxiety. So from health records and all, we can come to know that this patient is on anxiety medications, whether they are still continuing with those medications. Give information about citalopram. Citalopram is the medication they are using. So we need to selective serotonin reuptake inhibitor. So SSRI, that expansion also you can just completely you can avoid, because that sort of hard to crack terms. There is no need to use in a um, role play. Okay, so selective serotonin reuptake inhibitor. No, so instead we can say like this medication is used in both anxiety as well as depression. That sort of very hard terms, which a normal patient person will find it very difficult to follow. So you can just avoid that. There is nothing happening in your score and all. Okay. So, read for regular intake. We need to explain the minimum 4 to 6 weeks to be effective. We have to tell them that this is used in both depression and anxiety. It has to be taken for 4 to 6 weeks to be effective, and generally patients are doing well with these medications. We have to tell that. Fine. Advise patient to talk to GP if medication cancelled. In case they are concerned more about this medication, we can ask them to go and have a chat with our general practitioner. Fine. Explore any other treatment options tried. You need to inquire regarding relaxation techniques, counseling, and all. We have to find it out from the patient. Offer to give you information, leaflets, and website recommendations of relaxation techniques. Fine. Okay, so finally, we can end up the conversation by by offering them some leaflets, website information regarding relaxation techniques and websites. Okay, we can offer some information. I hope the question is clear. In case if you're having any doubt, please do comment me. I would be able to clear it, clarify it for you. Okay. So yes, I think all have gone to the question. There is nothing to be overly concerned regarding this question. It's quite very normal to follow, very simple. You have got enough and enough information, enough and enough of information's hints to elaborate. Okay, so shall we start? So we need to start by asking their general inquiry, especially their sleep. Overnight monitoring is over. Overnight, the term you need to notice. Now it's morning time. We are going to start with the situation. So how can you say that? Good morning. Good morning, Mr. Martin. So I'm taking my universal name, Martin. Okay. Good morning. Good morning, Mr. Martin. It's me, Abhilash. I'll be the nurse working with you today. Okay. Good morning. Good morning, Mr. Martin. I'm Abhilash, the nurse working with you today. How are you feeling? Okay. Hope you had a comfortable night yesterday. How was your sleep? Um, yeah. Okay. How was your sleep? Is everything okay? So likewise, you need to start the conversation. Good morning. Good morning, Mr. Martin. It's me, Abhilash. I'll be the nurse working with you today. Okay. How are you feeling? How's your sleep yesterday? Hope you had a comfortable night. Is everything normal? Is everything going on well? Okay, so that is the way by which we can start the role. A perfect rendition of an introduction you can give. Like, so the patient would be saying, like, no, everything is okay, sleep first and all is normal, but I'm quite annoyed at for making me woken up early in the morning. Okay, we can say like, I'm extremely sorry. I can understand your says. Okay, I value your feels, and like, I can understand what you're saying. I'm sorry, I can understand your saying. Okay, I can understand what you say. Uh, but say it is our hospital policy. It is our hospital policy. It's a routine in hospital for making patient wake up early in the morning. Okay, so that we could finish all the clinical assessment procedures before ward rounds. Okay, it is a must to finish temperature, pulse, oxygen levels, and all other vital signs before doctor's rounds. Okay, so that we can report it to the general practitioner. They could assess and act accordingly. Okay, they could assess and act accordingly. Right. So this is how we are going to convince. I'm extremely sorry. I can understand what you're saying, but it is our hospital policy. It is our hospital procedure to start clinical observations early in the morning. That is the reason why we are waking you up early in the morning. Okay. Um, that is the reason why you're woken up early in the morning. Okay. It is a must to finish observations, assessments like vital signs, temperature, pulse, oxygen levels, and all other vital statistics before doctor's round, so that we could convey it to the general practitioner during rounds. They can monitor, they can assess, and will do the needful, and can do the needful. They can monitor, they can assess, and can do the needful. Okay. So this is our hospital policy for the sake of patient safety. Okay, kindly cooperate with us. Kindly cooperate with us. That is the way by which we can do the thing. Okay. Well, how are you feeling? Are those symptoms still present? Well, how are you doing? Are those well? How are you doing? Are those symptoms still present? I mean, chest pain and dizziness, your yesterday's complaints. So we are just assessing the patient. We are asking the patient like that. Are those symptoms still present? I mean, chest pain, dizziness. Are those symptoms still present? Yesterday's complaints still present? Okay, tell me. So they will be saying like, oh nurse, that symptoms are not there. I'm feeling okay, nurse, but I feel like my heart is pounding, my heart is racing. That's the only complaint, but all other complaints are all, there are no other fresh complaints. I feel like my heart is racing, my heart is pounding. That would be their statement. Yes, glad to hear that you have made a great recovery. Yes, glad to hear that your recovery is uh, great. Okay. Yeah, you're recovering well. Also, you can say like, yes, glad to hear that you're recovering well. There is nothing to be overly concerned about. There is nothing to be overly concerned about. See, your current ECG reading is normal. Your current ECG reading is normal. Monitoring will be continued for a few more days, but monitoring will be continued for few more days. Okay, there is no evidence of any clinical problem or anomaly has been detected so far. There is no evidence of any clinical problem or anomaly has been detected so far. Okay, stay confident. There is no other problem. You are doing well. You are doing absolutely well. Okay, there is no threat. Okay, there is no cause for concern. Everything is going on well, Martin. Okay, stay relaxed. Everything is going on well. So this is how we can convince patient. Okay, and the heart rate or the pounding, it can be because of your anxiety. Well, it has been come to my notice. Well, it has been come to my notice that you are taking medications for anxiety. You are taking medications for anxiety. Okay. Well, it has come to it has come into my notice that you are taking medications for anxiety. Okay. Well, please tell me about that. Tell me more about that. So the patient will be saying like, yes, nurse, I'm taking medications for anxiety. Can you tell me what was the medication? Are you still continuing that? Can you tell me what was the medication? Do you remember the name of the medication? Okay, are you still continuing that? So the patient will be saying like, no, nurse. Well, what happened? Did that doctor ask you to cease medication? Okay, well, what happened? Why do you cease the medication? Did the doctor ask you to stop medication? Okay, so they will be saying like, no, nurse, citalopram was the medication. I have heard that it is used in depression also. See, I don't have any problem with depression. Then why should I go for taking this medication? So I've stopped it myself. Okay. Well, Mr. Martin, I understand what you're saying. Okay. Uh, okay. So you can say like, well, Mr. Martin, I see, Mr. Martin. See, this whole self-diagnosis and self-treatment are not appreciable. Okay. This sort of self-diagnosis and treatment are not good for patients. When it comes to medication, I agree. It is used in both cases. Like this medication is used in both cases. See, this medication has proven to be very effective since beginning. Okay, this medication has proven to be very effective from beginning, since beginning. Okay, many people of your situation have taken this. They all are doing well. Okay, this is used in. Yes, I agree with you. This is used in both cases, but you can confidently, you can surely take this medication because these are proven to be very effective since beginning. Many people of your situation have taken this and are doing well and are doing well. Okay, this is proven to be safe. This was proven to be safe. It has been used in clinical practice for many years. Okay, it has been used in clinical practice for many years. Okay, this medication was proven to be safe and effective. It has been used in general practice many years. Okay, many people of your situation are doing normal with this medication, but it has to be taken for a fixed period of 4 to 6 weeks to be effective. But it has to be taken for a period of treatment course of 4 to 6 weeks to be effective. Okay, but it has to be taken for a period of 4 to 6 weeks, treatment period of 4 to 6 weeks to be effective. 4 to 6 weeks to be effective. Okay, so if you finish the course, that will definitely work great help. Try it and see what changes does it make. Try it and see what changes does it make. Okay, if you're more concerned regarding the medication, if you are more concerned regarding the medication, you can definitely approach the general practitioner. You can definitely approach the doctor and can have a chat with the medication. Okay, chat regarding the medication. Okay, if you're more concerned regarding the medication, I could arrange the doctor's visit. You can have a chat with the doctor regarding this usage of medicines. Fine. What do you see? What do you say? So they'll be saying like, oh, nurse, I feel taking some advice from the doctor. Sure, I'll do the needful. Sure, I will do the needful. So we are making arrangements for them to have a chat with doctor. Okay. Okay, I need to certain some details regarding relaxation techniques and counseling. Have you tried any of this alternative or supportive therapies? Okay, I need to certain some details regarding relaxation techniques and counseling therapy. Have you heard of this? Do you have any idea regarding counseling relaxation techniques? Okay, um, have you ever tried any of this supportive therapies? They will be saying. So I have heard of some relaxation techniques and counseling, but I'm really not sure about all these things. Can you please get me some more idea regarding how to go for this? Okay, so they will be saying yes, along with medication, counseling, relaxation therapies. Okay, relaxation therapies including yoga, meditation, repetitive prayers, aerobic exercises. Okay, mall walking, brisk walking, jogging. Okay, and bicycling, swimming. These all are some sort of relaxation activities. Okay, try anything of your choice. Which one you feel more comfortable, you can try anything of your choice. Okay, so these all are proven to be really very effective cope with present situation. Okay, so that all your anxiety and anxiety related feels, thoughts, everything can be managed through this relaxation techniques. As I mentioned, you can repetitive prayers, deep breathing, okay, water aerobics, all those things you can try. Okay, so and counseling, it helps in sharing the feels, it helps in maintaining a better adaptation with the situation. Okay, so your doctor, you can take something which you feel more comfortable. If you're consulting with doctor, you can take an option. Okay, but I strongly suggest you to do this because it will that will help you a lot. That will help you a lot. That will help you a lot. All right. Hope you're getting me. Hope you are getting me. So, do you have any other queries for me? Hope you're getting me. Do you have any other queries for me? So they'll be saying like, no, no, absolutely. It was really a pleasure talking to you. It was really informative. Thank you. Thank you for giving me these ideas. All right, Martin, now I'll get you some leaflets. Okay. There are some leaflets and websites. Okay, that includes recommendations for relaxation techniques and counseling. Okay, so you can take that and can go through that. Okay, take it and go through that. Okay, so whatever you feel like, so if you're more comfortable, if you're okay, you can try all these therapies along with this medications. Okay, and you can, before that, you can have a consultation with the doctor, and doctor will tell you that for sure. Okay, you can have a consultation with the doctor, and the doctor will let you know that for sure. Fine. So here are some leaflets and website recommendations for relaxation techniques. Please go through it and to us stateful. Fine. So they will be saying like, sure, I'll through that. Is there anything else that you would like to ask or discuss? Is there anything else that you would like to ask or discuss? No, no, there are no other queries. Now I feel very comfortable. Thank you for coming to me. Thank you, Mr. Martin, for your interaction. Thank you, Mr. Martin, for providing me this much of information and having this talk. Okay, so now feel comfortable, relax. Okay, the doctor will be here soon for the rounds, and we will discuss more about your condition then. Okay, feel comfortable, relax. In case of any queries, feel free to contact. I'll be here around. Okay, I will be here around. In case of any queries, feel free to contact. I will be here around. Take rest, relax. Okay, take rest. That is the way by we are ending up the session. Okay, so we have come to the conclusion. Yes, I think all my dear students, you have just gone through this question. If okay, we have gone through this question thoroughly. In case of any queries, concerns, or doubts, something is there bothering means, please you could pin your suggestions on the comment box. We are will be very grateful and will be very happy in dealing with your concerns. Okay. Thank you all. Thank you for your cooperation. So this was our 44th live presentation session, and it is because of the consistent support and appreciation and encouragement from students we are continuing with this journey. So see you all for the next 45th session of this live presentation for by next Friday. Okay, I think it is on 21st. Okay, so I'll be back onto this virtual platform. Till then, take care. Bye.